One of the things we've done at the Department of Justice to ensure that we're bringing resources to our communities is to take a very aggressive approach in holding companies accountable for their role in the opioid epidemic. We joined a multi-state investigation into opioid distributors, and we've helped to secure settlements alongside counties and local governments in other states that have resulted in Wisconsin securing over $740 million that's going to go to fight the opioid epidemic over a number of years ahead. One of the things we're hearing about now is how those dollars are being used to make a difference. We were hearing from folks in Dane and Rock County yesterday, and today we heard from folks in Outagamie County, Brown County. Somebody from the Winnebago County Health Department joined us. And we are hearing that these funds are making a difference. They're working to address gaps that are where funds are needed. One area we heard about was the need for housing for folks who are in treatment. We heard about mobile units that are being used to reduce the burden that transportation poses. And we heard about some of the collaboration happening. So it's great to hear that these funds are making a difference. We want to keep hearing from partners so we know how these funds can be used most effectively and so that we can do as much as possible to fight the epidemic. So with that, let me turn it over to Secretary-Designate Johnson.
Good afternoon. I'm Secretary-Designate Kirsten Johnson of the Wisconsin Department of Health Services. As Attorney General Call mentioned, we have been talking to communities and partners that DHS is really proud to fund in the space of substance use prevention, and how do we really, in a meaningful way, leverage the dollars that we're tremendously thankful of the Department of Justice and Attorney General Call have really advocated for the state of Wisconsin. So how do we leverage those dollars and ensure that the organizations and the people on the ground doing the work have what they need to be effective to really combat the crisis that we're faced with opioids? Again, as mentioned, we were in Dane County yesterday talking about this and learned a lot today about the need for additional funding for transportation, for housing, and for prevention. So with that, I think I can open it up for questions.
How are these funds helping to deal with the prevention effort or the efforts to try to make sure they don't get to the street? Throw that out to whomever.
Well, why don't we both talk about it? I'll say a few things about law enforcement. One of the things this is doing is supporting law enforcement efforts that, among other things, has led to Narcan being distributed to a number of law enforcement agencies around the state. I hear from officers and from police chiefs and sheriffs about how critical that is and how many lives they've been able to save by using that, but also by empowering our law enforcement agencies. That helps us work together collaboratively as we work to combat drug trafficking. Now I know that education has been a huge part of this as well, so I'm going to turn it over to the Secretary.
So at DHS, and specifically in public health, we think a lot about prevention and the dollars that we put into working with youth and young people to prevent substance use disorder in the first place. I think one of the other places we're really investing in is mental health services. So how do we address trauma that people have experienced in their lives that ultimately lead to substance use disorders? And again, we are really asking and pushing for additional funding. So the 30% that comes into DHS, we have to get approval through the legislature, and part of that is if we ask for money for prevention, they have to approve it. So to some degree, we've had some challenges in that space, but it's really important to us to continue to advocate and ask for additional funding for prevention.
Efforts underway, Attorney General, here to decriminalize possession of small amounts of marijuana, try to get that whole process out of the enforcement realm there. Is that something that can provide a benefit, or could that be a setback at the same time, maybe the proverbial two-edged sword, as far as, one, you're taking funds that can be that have been used to deal with marijuana usage or marijuana misuse, is probably a better word, and at the same time, then does that send more people looking for the next high?
Yeah, I'll say a couple things. First, at the Wisconsin Department of Justice, our goal as we enforce our narcotics laws is to target large-scale traffickers who are dealing the most dangerous drugs. We all have limited resources, and using those to ensure that we are holding accountable the most dangerous offenders is key. We work as part of the Lake Winnebago area, MEG, for example, and that unit works in a multi-county way to fight large-scale drug trafficking, and among other things has seized fentanyl. So to me, we need to make sure our resources are going to the most serious cases. Also, the legislature has not shown much interest in addressing the current state of the laws recently. Personally, speaking for myself, I certainly think taking the step of changing our laws for medical marijuana is sort of a no-brainer. Not only do I think that we shouldn't be using our law enforcement resources in cases where people are using medical marijuana, but when somebody is struggling with chronic pain, I much rather would see somebody be able to have a marijuana prescription than using an opioids when we know how dangerous opioids have been. So I'm hopeful that we will see some change, but again, that's sort of where our focus has been.
Can you kind of give some context to the scope of the issue of opioids here in Outagamie, Winnebago, Brown County area?
Yeah, I think both of us can speak to that. I'll just say a couple things. First, there is positive news when it comes to fighting the opioid epidemic. There have been a lot of changes made that I think have helped. We've seen a decrease in opioid prescriptions. Things like the PDMP has helped prevent people from going to multiple doctors and obtaining multiple prescriptions. But we've had two major challenges. One is the pandemic that has exacerbated a number of issues, including mental health challenges. And then with the rise in fentanyl and other dangerous drugs has really led to a spike in overdose deaths around the country. It's really important for people to know. Well, one of the points that came up, we talked about at our roundtable yesterday, was how toxic some of what's out there is right now. It's always important for people to know how dangerous narcotics are, but it's especially dangerous right now with the rise in prevalence of fentanyl. And so that the more that we can encourage people to get into recovery programs to prevent substance use disorder in the first place, the safer our communities will be. Do you want to add to that?
I don't really have much to add other than to speak to the drug toxicity and the legalization of medical marijuana. I think one of the challenges we have now are people are using marijuana for chronic pain, and the supply we know that is not clean. So I think that's a real significant issue that we're faced with across the state.
Again, speaking about, this area of northeast Wisconsin more specifically, you mentioned, a pretty large figure regarding how much funding is going towards actually helping out with these issues. How much of that is in the northeast Wisconsin area, if you can, provide an estimate?
I can say a few things. So first, with those figures I mentioned, pursuant to state law, 70% of the dollars go to local and county governments, and we heard from County Executive Nelson today about some of the work that the county is doing. Municipal governments that were part of opioid litigation also recovered funds. And then the DHS programs are ones that programs in local communities can apply for. And we heard today about, for example, the county health department in Outagamie County benefiting from some of those funds. So it's difficult to quantify. I doubt you have the numbers offhand, but they're going to communities across the state of Wisconsin.
I was just going to say, I can't give a number offhand, but I do know that funding has been directed to this area of the state.
Did you all hear about anything today that really, piqued your interest, or, maybe you want to look further into something during this roundtable discussion? What was maybe your biggest takeaway?
I think one of the things that we've been talking about at DHS, and it came up today, was how do we, there is a workforce challenge across the state and across the country, specifically in healthcare. Are there other providers that we could potentially tap into, sort of peer recovery specialists or others, to help people get the help that they need? Knowing that there is a shortage of psychiatrists, there's a shortage of primary care doctors, there's a shortage of nurses, but are there other potential providers that at DHS we could acknowledge and in some way support?
Yeah, I'll just add quickly, one thing I was struck by is we knew that there was a need for additional funds to support efforts to combat the opioid epidemic. And no matter what amount of money we were able to recover, we knew it wouldn't be enough. So our goal was to maximize how much Wisconsin was able to bring in. And we've recovered and secured the recovery of a lot of funds. And one of the things we heard about is how that's filling some gaps. So housing and transportation were a big gap. We'd heard about how some of these funds have supported more access to housing for people with substance use disorder. And I mentioned mobile units before, which make programs more accessible to people in all communities across the state of Wisconsin, because those mobile units, by definition, are able to travel around and get to communities that may otherwise be underserved. So these funds are making a difference, but that doesn't mean that it's enough. So we hope that this continues to be supported through both efforts of the state and federal government.
Going back to a point that you made before about, you know, the fact that more money has to be asked for and it's not always met with, you know, a resounding, yes, here you go. Why do you think that is? Why do you think there's a challenge in asking for more money?
I mean, I think ultimately we don't, despite the large amount of dollars that's coming into Wisconsin, there will never be enough money. And it's very challenging to prioritize the needs of one community over another. And I think that's just, it's part of these conversations. And to Attorney General Call's point around leveraging those resources, we know that municipalities and counties are receiving funding. At DHS, we're trying to be thoughtful in terms of how do we fill those gaps? What are the places or spaces that may apply to across the state that need additional investment? And the other piece of these conversations is we're really learning and hoping communities come forward and say, you know, this is a gap we need that we don't have the flexibility to fund. Can DHS potentially fund in that space instead? So again, we want to make sure that communities aren't, you know, that we're not double funding things, that if a community has investment in one area of treatment, that DHS is not duplicating those efforts. So again, being very thoughtful about how we leverage all of the funds across the state.
Great. All right, thank you all. We appreciate it.
Thank you.
Thank you.
Sure.
Just want to follow up with you.